Thank you for giving opportunity to have a presentation. In Japan, DPP-4 inhibitor is widely used. About 70% patients was treated with DPP-4 inhibitor as a first choice. And 70% patients with type 2 diabetes are elderly patients. So, and the accumulation of the visceral fat has a relationship with the cardiovascular risks. So we had a study to evaluate the effect of sodium SGLT2 inhibitor ipragliflozin or metformin on reducing visceral fat and other effect in Asian elder patients with type 2 diabetes. Inadequately controlled with DPP-4 inhibitor, we performed a sub-analysis of a prospective multi-center blinded-endpoint randomized control study on elderly patients aged 65 to 74. As a method, the 103 patients inadequately controlled with DPP-4 inhibitor sitagliptin 50 mg. They had A1C 7 to 10% and BMI 22 and more. They are divided into two groups, ipragliflozin 50 mg or metformin 1,000 to up to 1,500 mg daily. The primary endpoint was a change of visceral fat area by CT imaging at 24 weeks. Two radiologists, they are blinded to the information evaluated the image. And the secondary endpoint, glucose metabolism and hand group strength, and the visceral fat and subcutaneous fat area and muscle volume and bone mineral density measured by the same CT slice. And also we evaluate the safety endpoint. Patient background, there is no difference between two groups. We used 28 patients for the sub-analysis. The mean age was at 69 years old. About half of the patients are male, and the BMI was around 26. And visceral fat area is 160 square centimeter. And the primary endpoint, the blue bar shows the ipragliflozin group, and the red bar shows the metformin. The primary endpoint, ipragliflozin reduced, not but metformin reduced visceral fat area about 70%. But both nasal drug affect subcutaneous fat area. And glucose metabolism, both drugs reduce HbA1c and fasting blood glucose from baseline. And the extent was a little larger in metformin group. And bone and muscle. Both nasal drugs affect bone density, but in the ipragliflozin group, muscle area was reduced about 3%. And interestingly, in the metformin group, hand grip strength is increased about 11%. It is about 2 kilograms. And there is no difference in other parameters. And regarding safety, 36% of patients treated with metformin had fatigue. In conclusion, as a second agent to be used in combination with DPP-4 inhibitor, ipragliflozin significantly reduces visceral fat area compared with metformin. For elderly patients with the risk of sarcopenia, metformin might increase hand grip strength, and ipragliflozin could reduce visceral fat for elderly patients with abdominal obesity. Our result can help with drug selection for the Asian patient, elderly patient with type 2 diabetes inadequately controlled with DPP-4 inhibitor. The main result will be going to be presented tomorrow. Thanks.